Sports chiropractor in Omaha. We are back here at the whiteboard for another whiteboard session to understand pain, injury, and sports chiropractic and how it may help. So if we talk about, like we had in previous videos, the equation capacity and load, and the relationship between one's capacity, which is what you are able to tolerate, and the load, which is the stress that you place on your body, whether that's physical, emotional, or social. Whatever this equation is going to kind of dictate what happens with injury and pain. So when our load exceeds our capacity, we are susceptible to pain and injury. That doesn't mean we always get it. Sometimes we get lucky, we can get away with it. We can have a very heavy load, whether it's like we're very stressed and we do a heavy workout and we don't get injured, but then the next time we do the same exact thing and we do. So that's kind of the crazy nature of it all. But when capacity exceeds load, then we are in a safe zone. We are not necessarily susceptible to injury, but also like we're not probably raising our capacity if that load isn't enough stimulus, and we'll talk about that later. So a well-intentioned clinician like myself, I used to explain this with a line like this, and then boom, you get injured in your capacity. So if this line originally is capacity, pain and injury often decreases that. So that's kind of this spot, whether that's we have more pain, we have less function, and that's kind of how I explained it to patients. So then I've explained, okay, well, our rehab exercises or treatment within the office is aimed at pushing this line back up. So things, we regain function, things that were normally not painful resume to be not painful. And I think that was effective to a certain extent, but as I've thought about it more, this is too simplistic. It's too much of a linear thinking. And I think that gets into trouble with patients and reconciling flare-ups and all that. So now how I think about it is that capacity, just like load, is ever changing. You know, our ability to tolerate physical load is directly related to the emotional and physical and societal stressors that we have. So that capacity line is actually kind of curved, you know, for lack of a better term. In this point in time where we're maybe more susceptible to different loads, maybe it's down here, maybe we had a hard workout, maybe we had a stressful day at work or with our kids, and then maybe we got a poor night's sleep. Now our capacity is lower than it normally is, and if our load exceeds that, then we are susceptible to injuries. And I think that's an interesting predicament because patients often mention, like, this is something I've done several times before without getting injured. So we have to ask ourselves that question is, what is happening to the capacity? Why is that? What are the new or unmanageable stressors that we might be experiencing that would explain why we became hurt or why we got injured? And I think that kind of helps. If we think of capacity as changing and we also think of load as changing, it's like this very dynamic system, and that's kind of the challenge, but also the fun part for me as a clinician to try to figure it all out. And that's also, like we talked in the previous video about treatment timelines and it not being linear, that explains why the rehab process and the recovery process is very, very messy. You know, there's a lot going on. Pain is so multifactorial that it's a lot to digest as a patient and a clinician. In the past, I think the chiropractic profession has become dogmatic and kind of buried its head in the sand and just said, oh, pain is due to subluxation. It's bone out of place, and we just put that bone back into place and everything's going to go back to normal and the body will adapt. And that's all nice and dandy, but I think it's a disservice to patients and to clinicians because it's just not true. And the fact that this is actually such a dynamic system and pain is so multifactorial, it makes it fun, but it also makes it really challenging both for patients and clinicians. So that's kind of why the rehab process is extremely messy. We do our best here to kind of sort it all out and give accurate information that's going to help in recovery and kind of put the patient back in control and understanding, once again, their pain and injury so that they can better respond to it. I hope that helps clear things up. Maybe it just muddied the water, but I mean, that's kind of